grateful to be alive. I want to take a moment to introduce Sovereign Health to you. We are a private behavioral health organization, and we are offering residential treatment programs to adult males and females. We offer dual diagnosis, primary mental health program, and an eating disorder program. And we're able to blend programming. So if somebody has addiction issues as well as an eating disorder, we're able to treat them at our program. Also, we have 2 locations, one in San Clemente in Orange County and also in Culver City in Westside Los Angeles. And if you have any questions, please come and see me. My name is Marissa Maldonado, and I will be at our booth here on your left. And so please feel free to come by and see me. Otherwise, I would like to introduce you to our panelist speakers from Sovereign Health. We have Jasmine Robb, the Director of Clinical Treatment Programs at our Culver City locations. And we also have Dr. Bobby Carlson, who is our Director of Training and Trauma. And we have Eric Carlson as well. So please welcome them to present on a panel of trauma and treatment. Thank you.
Good morning. My specialties are trauma and addiction, and I started treating trauma way back before there were any books on it, before there were any workshops on it, before there was anything, so we all sort of learned just by the seat of our pants to start out with, from our mistakes and from our, good stuff. So I've been treating boys as well as girls, men as well as women, for more than 35 years. And as you know, there are a lot more research has been done on women, because for a long time we thought that most survivors of childhood sexual abuse were women. And basically, that's how I got my specialty. I was a professor of nursing when I started practicing as a psychologist. And so I got a lot of women in the helping professions. If you get a lot of women in the helping professions, guess what you get? A lot of survivors of childhood trauma. And part of that trauma, of course, being sexual abuse. So, and if you work with a lot of people with trauma, how do you suppose I got my second specialty? 85+% of addicts have trauma. If they didn't have trauma before their addiction, they certainly had trauma from the wreckage of their lives after the addiction, right? Any of you have any familiarity with that? Okay. All right. And I always tell people that when you're victimized as a child, it's like you get this V on your forehead. Whether you're a boy or a girl, it doesn't matter. You still get the V. And that V is for victim. And then perpetrators are terrific at recognizing it. So people who are victimized as children are very much more prone to re-victimization. And it's really important to change that V from victim. And V for victim is like okay for girls and women, but what is it for boys and men? Not okay, huh? Boys and men are supposed to be able to take care of themselves, they're not supposed to be victimized, and all that bullshit that's in our culture. So, but they get the V, and it gets recognized by perpetrators, and they get re-victimized. And you need to change that to a V for victory. So, actually the symptoms of childhood sexual abuse in adults is very much the same. There are a few differences, but a lot of it's the same for both men and women. Fear, anger, depression, low self-esteem, lack of trust, eating disorders, post-traumatic stress disorder, addiction, feelings of powerlessness, suicide, fear of intimacy, disturbing thoughts, feelings of isolation, shame, and stigma. Tendency towards re-victimization, which I already mentioned, and dissociative symptoms. Now, not everyone has all these symptoms, but they are very prevalent. And they are prevalent in Who do you think has even more shame? Males or females? Males. Males, right, because again, it's not culturally okay, it's not sociologically okay. So they have to not only be, everyone who's victimized as a child has shame and feels somewhat responsible, but with boys, there's the shame of not really being a little man and then a man. You know, like of all the stuff that goes along with that, which is, as I said before, bullshit. So since they are victimized and then treated differently in sociological ways, it makes it much more difficult, I should say, for boys to report. So that's why we've had a lot more research on girls and women, because they have reported. Not easily, but more easily than boys and men. And very seldom do we get men, at least in my experience, come into therapy, and I'm someone who specializes in trauma, so people refer to me for that, but they don't usually come in for trauma. Most guys come in for depression, anxiety, PTSD, addiction. You know, those are sort of socially okay to come in for, right? And one of the important things as a therapist working in this field is to learn to ask. I've never forgotten the 13-year-old girl I had years ago, and I knew she had been in therapy before I saw her. And I was doing an intake and asking her the usual questions that I ask, which include questions about abuse. And when I came to sexual abuse, I said, "Have you ever been sexually abused?" She said, "Yes." And I said, "Well, have you worked on this in therapy before?" She said, "No." I said, "Why not?" She said, "Nobody ever asked." Nobody ever asked. And I've heard that story over and over. And some people did bring it up even though they weren't asked, they said, but like they discussed it once, and then they went on to other things. And so it's really important to ask those questions, and it's really important to have training, if you're a therapist, to work in the field of trauma, because it is different. And people are already traumatized, they're already looked down upon, boys even more so because they're not fulfilling their role, and then all they need is a therapist who doesn't understand. And so a lot of times, even with very well-meaning people, I'm not putting therapists down, they can be very well-meaning, but because they don't know, this man, this woman gets sort of re-traumatized. Because one of the big things is secrecy, right? You're not supposed to talk. A lot of times you're threatened that if you talk, you'll be hurt, or your family will be hurt. And so the secrecy and the feelings of powerlessness are tremendous, as well as the guilt and shame. And so if they get the idea from a therapist that it's not okay to talk about it, because lots of times they already got that idea from their families. Some people did report it to their families. Some didn't because they were too afraid to. But some of those who did, unfortunately, were blamed. And the other thing that happens with boys, because boys are abused by both men and women, and we used to think just men, you know, but that's not true. They're abused by both men and women, and either way, it's sort of looked at differently. It's like, well, if they're abused by men, well, it's part of growing up. And if they're abused by women, hey, they were lucky. Right? They were lucky. They had this older woman to really teach them the ropes. Well, neither way are they lucky. Neither way are they're certainly the opposite of lucky. And they really need therapy, not just for the depression, the anxiety, the low self-esteem, the fear, the shame, the guilt, all those things. They really need to be treated with respect, with kindness, with caring. And one of the first things in treatment of trauma survivors, whether they're men or women, is safety. because they have been so unsafe and had so many feelings of powerlessness for so long that they aren't going to go anywhere with treatment until they can feel safe. They need to feel safe with the therapist, they need to feel safe in their environment, and they need to feel safe with the therapy. And that's not easy. So sometimes if therapists are not knowledgeable, they want to get right into the trauma. Well, that's not a good idea. For one thing, sometimes we decompensate people that way. For another thing, we certainly don't help them feel safe, because it brings back all these feelings when they start talking about too much too soon. So we need to do some things to work on seeking safety. One of the things that's really important is to do some relaxation and guided imagery with people being able to find a safe place, and knowing that they can go back to that safe place whenever they feel like they want to or need to. We really need to work on affect regulation, because, you know, I've argued with the chemical dependency people for a lot of years, and I'm happy to say they caught up with me. But the argument was, they would say, you can't treat trauma when somebody's first in recovery. Okay? Well, I wondered, I didn't really wonder, I'm being facetious, but why I would get all these people that had been to all these rehab programs, good programs, not putting them down at all, but the trauma never got treated. And so, what becomes a trigger for relapse? All the feelings from the trauma. So as you heard, I'm director of training at Sovereign, and I actually started a long time ago. I developed a trauma program at Los Encinas Hospital in Pasadena and ran that for the years that it existed. And until now, nobody can stay in the hospital long enough for treatment of much of anything. But, and I mixed men and women in the group, and a lot of people had not done that. And it was very effective because, like I said, so many of these symptoms are the same. And a group, besides individual therapy, group is really important in the treatment because they don't feel so alone. And they can really relate to each other and help each other. And they pick up, you know, I always had a co-facilitator. I used to run a lot of groups. And I always said, well, if I didn't pick up something, the other person would. Well, actually, after these people, trauma survivors, I forgot one symptom, hypervigilance. They're so hypervigilant that if either one of us missed anything, somebody in the group would get it, because there are two groups of people that are hypervigilant. One is survivors of childhood trauma, because sometimes their lives, or certainly their well-being, really depended upon it. The other one is cops, because they have to learn to be, because their lives can depend upon it. Well, in mixing these groups, one time, you know, there's been a lot of talk about the Catholic Church and priests with abuse and horrible thing in our culture. And a priest that I treated, I was the group leader, another person was his therapist. And his therapist, his psychiatrist, and I had a meeting. And when he was going to come into the hospital, this was when the trauma group existed, and he was a perpetrator, but he was also a survivor. So we all agreed, and we felt a little uncomfortable about this because of the secrecy issue, but the only way we could possibly let him in that group is if he didn't talk about his perpetration. And so, of course, he talked all about his abuse, and it went very well. And he was going from there to a place back east that had special program for priests. And he said that he was so glad he was involved in this program, because never did he realize, I mean, he's one of the guys who really felt like he did wrong and was really contrite and really remorseful and really wanted to change. But he said without this experience, he would have not had a clue of how damaging sexual abuse is. because when he listened to the other people in the group and saw the damage that was done to them, that was more than anybody could ever tell him or he could ever read about. And he did very well in the program, and he continued working on himself. And sometimes when people are perpetrators and they do come to a place where they are remorseful, they do feel like they're doing something wrong, and that they're not accusing a 5-year-old of being seductive, then that's a different kind of than the chronic pedophile. And a lot of times they can be helped more than the chronic pedophile, who thus far we haven't found a lot of effective treatment for. So I'm now going to turn you over to Jasmine, who will talk to you about mindfulness.
Hi, everybody. Hi. That was wonderful, thank you. She's wonderful. I would like to start with something that is very essential in my understanding for the treatment, of the population of survivors of sexual abuse in childhood and addiction, which goes together. Dr. Carson touched on that a little bit. I have a personal experience through my 12-step program where I began to sponsor people. Do you hear me? Is that, because I don't where I began to sponsor people, and as part of the 12-step approach, which is so helpful for the treatment of alcoholism and addiction, is the concept of forgiveness. Now, forgiveness, I want to just start out by clarifying this a little bit. There are different aspects of forgiveness, and I was very confused with it, and I didn't know, I felt it's just simply disrespectful to tell anybody, to even mention that word. I just thought it's just too controversial and too problematic, and to just not even talk about it. And as a matter of fact, I was told to not talk about it today either. Yeah. You may guess the program I'm in. So anyways, the forgiveness is something that that we have to discern here. We have to differentiate. One is the legal aspect, you know, where you talk about having the perpetrators going through that. And I'm going to say that all the many addict male and female survivors that I personally know and that I have met and they have listened to, not one of them went through the legal system about the event and the perpetrators. So all the numbers that we hear about this are beyond questionable. It's just really hard, especially for the males, but also for the females. So there is that. So the legal system is on one side, but on a personal level, I'm talking to somebody who is trying to save their lives by dealing with their addiction, by trying to stay sober and going through the process, and they're asked to forgive. And how can you say that to a person? So I didn't really know what to do about it, but I'm kind of like I grind myself into this, into things, and so I came across a beautiful story that to me showed what forgiveness can be. And this story is about a Native American young boy that was, his name is David Paladin, and he was used during World War II. He was used as one of the wind talkers. You guys may have heard about it. And So this boy was, he was a teenager at the time, and he was left in Germany behind enemy lines, because his language, his Navajo language, was used as like a secret code. And he was captured by the Germans, and he was tortured by them nailing his feet to the ground for days, and he got gangrene. And when he was liberated, he weighed 70 pounds, and he was in a coma for 2 years. And he was only 21 at that time. And so he came back to his people, and he on braces, he couldn't really walk, and they said, "Oh my God, what happened to you?" And he said, "The Germans." And they said, "No, what happened to you?" And he said, "The Germans." And they said, "No, it's like you. What happened to you?" And he again wanted to say, "You don't understand what happened to me." And they said, "No, it's not about what happened to you. It's not about who did it. Your spirit is not with you. You must get your spirit back. A man cannot live without his spirit. You must get your spirit back or die." And they, as part of like a ritualistic thing that they did, where he had the support of his people, they threw him in the water, and they took his braces off first. They threw him in the water, and they said, "Swim and get your spirit back. You must get your spirit back." And that's the story. And he recovered from all of this on like a very beautiful way, and he lived a long and good life. And so when I read this story in this beautiful book by Carolyn May's Why People Don't Heal. And she speaks of physical and emotional problems and the difficulty that people have allowing a healing to occur. And the way I understand it, it's particularly difficult for when there has been the most difficult situation is most probably when it's a male child and the sexual molestation was an incest very early in life by well, without getting into the details are just always really gnarly and maybe not so important. The important part is that there is trauma, and the trauma is complex, and it is pervasive, and it is persisting, and it is as though the child gets, on an energy level, gets connected to that event and the perpetrator forever. Freud coined the term cathexis for this, for an energy connection to something, of the life force of the person. And I imagine there's like a rubber band from the victim's like core to that perpetrator. And that rubber band that connects the victim to the perpetrator is anger, wrath, and this futile and tragic attempt to undo the past, to undo the own lack of success in dealing with that horrific situation that happened. And so while anybody can understand that the victim may have some sadistic fantasies of torturing all the perpetrators, I get it. It's still not a way to heal and move on. So in order for healing to occur, this connection to the perpetrator via anger and resentment and wrath is to be severed. And so that the energy of the person can be utilized in healing in such a way that the shattered personality can become whole again. Because this is what happens with such severe trauma in childhood. The person becomes fragmented, there is a dissociation that happens. People get kind of vague. They make it about the perpetrator, whether it's the Germans or whoever it is. And so they remain in this state where they lose themselves, where they don't have like a sense of identity or a clear sense of self. And so in recovery, what must happen is, aside from we start out, of course, first by somebody that is using addictive substances to first get that person clean and sober so that they get their brain back. That's the first step. But during that time, we have to enable for them to start the process of healing their trauma. And this is through psychotherapy, and it is through the 12 steps, and it is very much through mindfulness, to where they start to meditate and pray and read and write and identify their feelings, like a somatic experiencing part where they feel where they are in the body right now, and part of that can help to like really own the fact that those traumatic events are over for good, and that right now, as the person is sitting in meditation, there is no such thing happening. That it's all as a wound and as injury, but that now this wound and this injury is allowed to heal, and that the person gets support and guidance with this, because clearly they didn't have any of that in their childhood. They had no good role models, they had no protection, but now they do. And to take the spirit to the present moment, and to do this repeatedly on a daily basis, preferably twice a day for 20 minutes, and to focus on breathing, on being here. And this is what also changes some of the cognitive distortions that happened, and it actually, on a physiological level, can change the brain. So I'm gonna thank you very much for listening. Eric Carson is going to explain a little bit about the brain in this context. Thank you.
Well, yeah, I guess you know my name. My name is Eric. And I could use the title doctor I'm entitled to. I was a doctor of chiropractic for 14 years. When I was 8, I have 22 years of personal recovery in May from addiction. When I was 8 years clean, I had resigned my license. In the course of my active addiction, I engaged in a lot of behaviors which made me contemptuous of law and restraint in regards to law. So I had bad habits. So when I had to resign my license, I had to figure out what I was going to do with the rest of my life, how I was going to support myself. And because of a background in neurology as a chiropractor, I became interested in a lot of the research that was coming out. I decided to engage, become a counselor, and engage in helping other people, because I had been in the helping professions. So I got a more concentrated focus by what I attended to in why things happen, why we are the way we are. So I would like to start by saying that behavior is a road that is built in your brain. And once built, it never goes away. That's the bad news. The good news is you can build new roads. There's a caveat to that. New roads have to be constantly maintained. Now, why are we like this? We're like this because we start out and we develop. We don't get dropped into the world fully developed. Our brains have to develop. They have parts. Those parts have to develop, and they develop at different rates. So when a child gets exposed to certain events, it has a different reaction than an older person. The younger the child is, the less conscious the reactions are, because the part of your brain that's in charge of explicit memory is deep inside, not the cortex, normal thinking part on the outside, deep inside, and it's not fully developed. So when you're really, really young, you may not even have conscious, explicit memories of the trauma that happened to you. But you will have responses. You will have feedback loops that get built. The player in that is in all their wisdom, the scientists call that the hippocampus. It's a switchboard. But before it can even get there, when things happen to you, they come in through sensory data, right? They come in through your 5 senses, and they go to a switchboard. And that switchboard routes them to other places in your brain to be processed. Okay, that switchboard is called the thalamus. It's down in one of the primitive areas of your brain, because every living animal has that part. Every living reptile or a bug has that part. So in that part also are actual directors of behavior. We call them basal ganglia. Those are when, how many people here play a musical instrument or were ever involved in a sport? Okay, you all have very active basal ganglia. Because when you repeat a behavior over and over and over again, it becomes an automatic reflex. You don't have to think about it. True? So when certain things happen to you, you build up reflex loops. And the more times that is repeated, the more that is reinforced and the more solid that loop becomes. When you have intense emotional experience, okay? Because one of those loops is going to be identification. This is a fearful stimuli. This is a dangerous situation. And we don't, people are familiar with the flight and fight response, right? Okay? So we're going to have 2 things. We either want to run or we want to defend. So what about if you're a child and you can't run? What about if you're a child and you can't defend? Well, the oldest response that animals have in that situation is the freeze response. Okay? Respiration goes way down, heartbeat goes way down. It's a really intense response. Dr. Carlson mentioned dissociation. This is what needs to be engaged in order to engage the dissociative response. When you hit that level, you go away. Well, when you're being traumatized, that's kind of a nice place to be. So, how many people have a background in addiction treatment here? So you're kind of familiar with dopamine, right? It's one of the neurotransmitters that is really important to survival. The reason that drugs work so well is because they make dopamine. And the reason that dopamine is so important because at this very primitive level, it tells you, oh, that was successful for finding food. Oh, that was successful for finding something to drink. That was successful for reproduction. That was successful for defense. I think I'll remember that. And it associates it with this, oh, that feels good. So you're not going to forget it. You learn that behavior. Well, as dopamine starts encoding memories, it is the more intense the experience, the more the dopamine, the less repetitions are necessary for that to be encoded in memory. So when we're traumatized, emotional intensity is really high, neural pathways get built really fast, and they never go away. So, what are we going to do? Some people with trauma can't consciously remember when it occurred. Some people with trauma can remember, but their memories become so unpleasant that the director up here says, no, don't think about that. Not only that, but when you're under constant stress, there's things that get released into your bloodstream. Cortisol is one of them. And when cortisol levels are constant and high, neural pathways in the brain actually get eroded. They get, there's a negative consequence. Certain areas don't get smaller. They don't function as they're supposed to. So there's all these little short circuits going on. Doesn't sound very hopeful, does it? But we have seen practices. They've been traditions, spiritual traditions, for thousands of years, which seem to have provided answers to this problem. And in the past 20 years, we've actually done the research to establish that yes, they truly do change the brain. So mindfulness of various techniques actually changes the brain. It helps to develop the areas that have been deteriorated. It helps to change that automatic fear response so that it's more manageable. You learn to be able to sit in the presence. Because it's great, you go into therapy and you've got trauma issues and you get exposed, you know, someone wants to dig those issues out, you get like, because everything that happened around you, every sensory thing that happened around you in association with that trauma got encoded into memory. So you can hear, okay, I was a heroin addict. To this day, and I stopped doing heroin 10:15 p.m. December 31st, 1973. That was the last time I IV injected heroin into my body. Today, if you light 3 paper matches, I can still smell the smell of heroin cooking in a spoon. Okay, that is still here. But I don't have the same response to that today as I used to. That used to engender a tremendous craving response. Today it doesn't. It's only through the practice of mindfulness that I've been able to achieve that. It's only through working the 12 steps, the 11th step, which involves prayer and meditation, that I've been able to modify those outcomes. So that doesn't make me crave like it used to. It doesn't engender the same response. I can code new pathways. I can code new processes. But if I ever stop practicing that will gradually erode, and I will return to the longest term behaviors that were coded in my brain prior to that. So I was an addict for 28 years. What do you think I'm going to do? How many people here know people with double decade recovery who have gone out? Okay? So time, as it by itself, is not a measure of safety. It is the practices within that time that allow us to keep our resilience. Thank you.
If there are any questions of any of us, we'll be glad to answer. Also, there are some handouts at the Sovereign table if anybody's interested. Any questions? Yes.
You address this first, then I'll finish.
Thank you for asking that. I have put together on one paper the essential aspects of mindfulness, and it's at the table there. Yes, there is a little formula. Essentially, it's meditation and prayer in the aspect of taking it to the present moment. Because as humans, we live a lot in fiction and fantasy and dream and fear and imagination. And it's all about the future and the past. Mindfulness will tell you, you only live right here, right now. Everything else is fiction, only happening in your mind. Life only takes place right now. And to reiterate that, like Dr. Eric Carlson said, by repeating it on a daily basis, and then through the prayer aspect, we help for the brain to return to a more lesser arousal state. And we also repeat that and practice that. That would kind of be the basics. But get my little paper.
Yeah, it's great. Jasmine's a great writer. And she's got an example of her book over there, too, called To Hell and Back, which some of you might relate to. Probably all of us can relate to in one way or the other. I also wanted to recommend a book that I found, you know, even after all these years that I've done this, I haven't found a book until recently that really was so well done for boys and men. And it's Sexual Abuse of Males by Joseph Spiegel. And it's really excellent. I was very impressed with the work that he's done and the model that he's put together for the treatment of boys and men who've been sexually abused. Eric, you want
Yeah, I'll address that. Just one thing. Mindfulness can be dangerous. Today, the research is going on compassion mindfulness, compassion meditations. With somebody with a strong history of trauma, I wouldn't jump into compassion meditation. It can actually have very negative consequences. But you start out with mindful acceptance, work on gratitude meditations, and then you can come to compassion. But if you know, like any other technique, if you're going to use it in a clinical setting, you really need to pay attention to what's been done in terms of the research.
You need to know what you're doing.
There are different forms of meditation that people teach that lead you probably to the same result. But does it matter which one?
That's what I was just saying. It does. If you have a trauma history, it makes a big difference. If you don't, less so. But with a trauma history, you can actually be cued into being overwhelmed. So you really don't want to start out with a compassion meditation as it's taught. You want to start out with a mindful acceptance and work on gratitude. Especially addicts for two. A gratitude meditation is great. You know, so attitude and gratitude, we say, right? Okay, there's a reason why that works.
And finding a safe place, first of all. That's
yeah, guided imagery.
My question
That's one of the most important things, is to help people with guided imagery to find a safe place before they move on to other methods.
Even mindful meditation has different forms, so I was wondering, you know, some people concentrate on the breath, some people have a mantra, some people have, you know, different ways of getting to mindfulness.
Let me answer that. There is the aspect of meditation where you focus on your breath. That's really the essence. Via the breath, you center into the present moment. Then, in addition, there is an aspect of some mental construct, some thought, some visualization, some mental imagery. For example, I give you one of my favorite ones that the patients also always like is with the breath, you focus on golden, loving, divine, healing, light energy entering your system as you inhale, and you exhale the dark gray energy of fear. Every breath, you inhale the golden, divine, loving, healing, light energy. And you exhale the dark energy of fear. Okay? That felt nice, right? Okay, so now you know that whatever you focus on in that meditative mode has a big impact. So we want you to focus on something pleasant, calming.
I just wanted to say that one method is not necessarily better than another, to answer your question.
Mine are best.
But it needs to be customized to the person and to the individuals that you're working with.
And just to say one more thing, you mentioned like mantras as a form of meditation. The research today actually shows that these different forms of meditation actually affect different systems in the brain. So if you are expert enough or you have enough information to know what the client sitting in front of you needs in terms of reinforcement, you can make better suggestions. But the bottom line is mantras aren't going to hurt you. Compassion meditation might hurt you. Loving kindness meditation is not going to hurt you. Mindful attention meditations aren't going to hurt you. So the only thing you have to be wary of in dealing with trauma survivors of any sort, sexual or otherwise, is the compassion meditation. And that's just because of what it activates in the brain.
Any other questions? Thank you very much.
Oh, there's a couple.
Oh, wait a minute, there was a question, I'm sorry.
Two more. How many DVDs or CDs that you're selling?
You know,
This is fascinating.
I know, I used to have a tape, and now tapes are outmoded, so I need to do CDs, and so does Jasmine. We all three do this, so we need to do that. Thank you. Yes?
In using this, does it matter that, like, the young adult's brain is not fully developed versus the meditation?
As a matter of fact, it matters like this. It helps the development of that part of the brain which is not fully developed. So when you're dealing with the part of your brain that makes decisions, that has showed that develops insight, that sees consequences for behavior, yeah, it helps develop those parts. So, good thing.
One of the exciting things that, and one of the reasons that I'm working at Sovereign, I also have a private practice in Pasadena, but is not just trauma and training interns, which are two of my passions, but another one is cog rehab. And it's one place that's doing cognitive rehabilitation, which is really like the cutting edge treatment for addiction. And it's not only, now we found it's not only good for brain trauma, but also for the brain trauma that comes from addiction. And so that's really exciting to watch that. And when people get tested and then they do the brain games and they improve, it's also improved self-esteem. Thank you all very much.